members and representatives from the healthcare sector and government officials, good morning. This is the fourth meeting of the Bills Committee. And we had 3 meetings before, and that included a public hearing for different sectors. It's based on members' recommendations, and we sent invitations to the social welfare sector and the education sector. And today we have the healthcare sector coming here to give their views on the bill. Now, many members have put forward many recommendations. The Secretariat issued invitation to 100 groups from the healthcare sectors at 2 p.m. on the 24th of November. 28 groups responded that they would attend the meeting, and they are all from the healthcare sector. Now, for deputations that have yet to submit your written submissions to us, please do so after the meeting, and please submit it to our Secretariat. Now, the usual arrangement is each deputation representative has 3 minutes to speak. There is a timer that you see, and you also hear beeping alerts when it's almost time. And if you require simultaneous interpretation service, you could wear the earpiece for Cantonese, English, or Putonghua interpretation. If I may remind deputations that their speech is not protected by the Legislative Council Powers and Privileges Ordinance. And also, please pay attention to the notes for members of the public attending meetings in conference rooms or observing meetings in public galleries in the Legislative Council complex. This note has been attached to the invitation to the letter sent to you, and so please we'll make arrangements in accordance with this note, and please observe order and please do not shout slogans. First, I'll invite the Undersecretary for Labour and Welfare, Mr. Ho Kai Ming, to take us through the bill briefly. Thank you, Mr. Chairman. Good morning, friends from the relevant sector. Now, through this mandatory reporting of child abuse bill, we would like to inculcate a culture of early reporting of child abuse and achieve protection for the children. That's our policy objective. Now, the Chief Executive announced in his last previous policy address that we will set up a mandatory reporting mechanism. There is a cross-bureau working group comprising the Labour and Welfare Bureau, the Education Bureau, and the Food and Health Bureau, the Health Bureau, and the Security Bureau. We conducted 2 rounds of consultation on relevant advisory bodies and the welfare, healthcare, and education sectors. And then the working group twice briefed the relevant panel of this council on the proposals. Now, the bill applies to persons under the age of 18, and there are professional practitioners from the welfare, education, and healthcare sector. They will be made mandated reporters if they have reasons to believe that a child has been suffering serious harm or is at the real risk of suffering serious harm. Early reporting must be made. Otherwise, it's an offence, and there's a fine of $50,000 or imprisonment of 3 months at most. There are also defense provisions to offer legal protection to mandatory reporters, because professionals from 3 sectors, that is the education, welfare, and social welfare sector, so that will provide a wide protection web for children, and also the bill will serve a deterrent effect. Now, we are going to provide training and develop a guidelines. We have said that and provide a guide for mandatory reporters. We said we'll do it early next year. The mandatory reporters guide will set out the principles for protecting children, and also there will be information on how they could identify child abuse cases. This is to prevent over-reporting. Then, as we formulate the guide, we will invite mandated reporters to take part in the exercise. Now, we want to make sure there is proper training for mandated reporters, and then for relevant professional bodies, they may need to review their own professional code. So, after the passage of the bill and the Gazette of the bill, we will only implement the mandatory reporting regime 18 months later. And we have made reference to the experience in other places. We believe that after the bill is commences, there will be increase in reported cases. So we will be providing more child care residential places. And we will also step up publicity and education. We want to enhance awareness on child protection. There will be support and other preventive measures. So there will be a interlinked child protection web for children, and we will also listen to the views of the sector, and we will support the work of this council on the scrutiny of bill, so that we could take the first important step towards mandatory child protection. Now, in previous meetings, we have the Labour Welfare Bureau leading the team, and also representatives from the Education Bureau, the Health Bureau, and also the Department of Justice. But there are other representatives joining the meeting today. Can you? Well, yes, in the team we have colleagues from Education Bureau and the Health Bureau, because there's also collaboration with the public healthcare sector. That's why we have invited colleagues from the Department of Health and the Hospital Authority to come here to answer members' questions. So yes, so we have representatives from the Department of Health and also the Hospital Authority. Now the deputations will speak. They have 3 minutes each. First, Professor Patrick Yip of the Hong Kong Pediatric Society. Good morning. I'm Professor Patrick Yip from the Hong Kong University. I'm also a practitioner, frontline medical practitioner, in fact. I would like to give my views on the government's child protection policy. We're seeing a major change. Now, the many in the frontline sector, including the Hong Kong Pediatric Society, we have been noticing serious problems with child abuse, especially during the COVID pandemic. Many children were exposed to undue risk, and then there's no timely identification and intervention, so the risks are even higher. That's why we are in support of the mandatory reporting bill. I think the intention of the bill is to achieve early identification of children at risk. And then for practitioners such from the education, welfare and healthcare sector will be able to identify children at risk at the earliest possible stage. And this, and then for mandatory reporters, the current scope covers, or rather the age is set at 18 or below for children. We believe that's good because it will cover the most vulnerable group of the age at 15 or 16. Now, there are various support measures the government have put forward. We hope that before the commencement of the bill, the government will make sure training has been conducted, because there are many different practitioners of these three sectors. They still do not know what the bill is about, and not every sector has the skills to identify children at risk. So that's why training is the most important aspect among the support measures. And also, in terms of resources, the government needs to do more to care for children in need, or those at risk of abuse. We hope that there will be a party that's best at caring for children after a case has been reported. We also need to help families in need. We don't want children to stay at hospitals for too long, because it will affect the operation of the hospital, and also there is a higher infection risk for children staying at hospitals, and hospital is definitely not the best environment for them to stay there too long. So we would like more collaboration between government and the various sectors so that there would be proper support for our child protection effort. Thank you. Next, Dr. Risa Bianca Wong from the Hong Kong Dental Association. Good morning. Now, we welcome the government's determination to enhance child protection. Now, we have submitted 3 submissions in total since last year on the bill, and we thank the Bills Committee for its effort. On behalf of the Hong Kong Dental Association, I'd like to give our views. First, now, there are going to be penalties such as fine and imprisonment for failure to report, and we have reservation about that. We believe if we go by the professional code, and if someone fails to report, then if there is disciplinary action, that may even cause disqualification, that we believe that's better than criminal punishment. Because then if there is over-reporting because people are afraid of the criminal penalty, then maybe we won't be able to give help to those in real need. And the government must provide sufficient training to mandated reporters so they're able to perform their duties. Now, over-reporting will have negative impact on trust among family members, and children will be put under undue pressure. And secondly, the views of children must be respected. The government should involve children in the discussion process, and they should listen to the will of children. And then the government may also consider if the mandated reporters should consult the relevant child professional sectors such as social workers before making a report. Before there is sufficient training, dentists and other healthcare personnel should not be held criminally liable. Thirdly, we suggest that there should be different stages for implementing the mandated reporting mechanism, which is first start with those who have frequent contact with children, such as teachers, child care workers, and social workers, because then they may then we'll be able to identify any problems, and then adjustments could be made. The fourth point, for registered dentists and dental oral hygienists are listed as mandated reporters, but dental therapists work under the supervision of dentists. If they are not listed as mandated reporters, there will be loophole in the reporting mechanism, and also it will be difficult to delineate responsibilities. The Dental Association is more than happy to work together with the government in different sectors to protect our next generation. Thank you. Next, Dr. Pong Chiu Fai from Medical Conscience. Good morning. Thank you. On behalf of Medical Conscience, I'd like to speak here. Now, we are a group of doctors, nurses, and healthcare professionals. The Medical Conscience agrees that the government needs to legislate for mandatory reporting of child abuse. We believe this will help to protect children from being harmed. Mandatory reporting will offer more protection to children. It's an effective and a timely way to expose child abuse cases. Now, we have a number of suggestions. Firstly, if the law says that if someone knows that another child carer has already reported the case and the person is relieved of his obligation, but then this should not be sufficient defense. Medical personnel should also report cases. And then, of course, if there is conviction, the medical professional may be imprisoned. So if a doctor is involved, then there will be a report made to the medical council. If a doctor is convicted, it will affect his qualifications to practice. So there is serious impact. And then in medical institutions, very often there is practice of team responsibility. And then there's a question of who should be held responsible. Sometimes it's hard to tell, so it will make a conviction or prosecution more difficult. So, and then the government must also give full support and protection to mandatory reporters. As for professionals working in different organizations, the organizations should give their staff sufficient support. The government must make sure that there is proper training for all involved, so they know how to handle cases, and they'll be sensitive to in doing so. And if medical professionals are prosecuted, then the government must make sure there is enough room for the professionals to give of their defense, and the person should not be prosecuted for professional misconduct, because then he will have no future left in the profession. And then there has to be proper publicity and education as well. And now, if we want to have early identification of child abuse, and we need to respect the parties concerned, so we need the support of the social welfare and other sectors. And then it's also about public education. Now, with the collaboration of professionals, and then the government could improve the system. And then with a stronger penalty, they will be able to prevent tragedies. Thank you.
Next, we have from the Council of the Hong Kong Academy of Medicine, Professor Gilberto Leung. Thank you, Chairman. Good morning. The Council of the Hong Kong Academy of Medicine welcomes the legislation to protect children. We would like to know more about a few points. Under the law, if a doctor has reasonable grounds to suspect that a child has been suffering from abuse or harm, is at risk of suffering from serious harm. So what constitutes a reasonable suspicion? From the medical perspective, it is often the case that we rely on the perspective or views of the specialists or general practitioners on confirming whether it is a case that can be substantiated. Say, should a surgeon talk to a pediatrician, or should we compare ourselves or talk to the teachers before we confirm a case or make a report? We would like to know more about that. On defense, the law says very clearly that there are a few defenses, but healthcare practitioners are very busy. Sometimes they are unable to make a report promptly. So we would like to have an extra defense, say under reasonable circumstances, we can have relevant protection. Third, on training, we have over 10,000 doctors in Hong Kong. We understand that after passage of the bill, there will be time, say 18 months, for the healthcare profession sector to provide training. But if the doctor is unable to undergo training and do not make a report, who should be responsible? We would like to know more about that as well. Lastly, we would like to talk about the penalty by imposing criminal liability on healthcare professionals. When doctors make a mistake, we charge them with professional misconduct or pursue the doctor with a civil liability. Why do we impose such a criminal liability on failure to report on doctors? Criminal liability only applies to extreme cases in our practice. Reporting of child abuse is it an extreme case? We think that we should consider it further. And the subjective views of the doctors have not been considered in the bill. This is a form of strict liability. I think that we should think about that. Thank you. Thank you, Professor Leung. If you have any supplementary comments, or views, please provide that to us. Next, we have from the Hong Kong Occupational Therapy Association, Ms. Fong Siu Lai. Thank you, Chairman. Good morning. Pediatric occupational therapists serve children with special learning or care needs. The Hong Kong Occupational Therapy Association proposed adopting a family-oriented approach to protect children's safety and support families in need. The association hopes that the mandatory reporting of child abuse bill can prevent child abuse and reduce the probability of child abuse cases. Regarding the bill, the Hong Kong Occupational Therapy Association puts forward the following opinions on reporting mechanism and channels, on the job training and professional liability insurance. And we have some questions as well. On reporting mechanisms and channels, we think that the bill can include different levels of abuse and add corresponding support to the bill. We can add some case illustrations to avoid misreporting. Sometimes occupational therapists have to report to their supervisors or discuss the case in meetings. If the supervisors or team leaders do not make a report, who should bear the responsibility? The mechanism should include arrangements for supporting families of abused children and specify the person in charge to ensure that families of abused children receive appropriate support after reporting. This is what we concern a lot about. Second, on the job training. Inexperienced occupational therapists may not be able to determine if a certain child has been or is at risk of being abused during a short therapy session. On the job training is particularly important. The training should cover, for example, how to identify abused children, how to handle the case and follow up, and how to make a report such that we can minimize the impact caused to the abused children and their family. Third, on professional liability insurance. Occupational therapists in private practice are concerned that an additional layer of risk will lead to a rise in professional liability insurance premium, and hope that the government will take note and provide support. Finally, the Hong Kong Occupational Therapy Association hopes that the government will put in more resources to provide family support, such as by offering occupational therapy services so that families know how to handle children's learning or behavioral problems to reduce the risk of child abuse. Post-reporting support should include occupational therapy. Thank you. Thank you, Ms. Fong. Next, from the Hong Kong Medical Association, Dr. Pierre Chen. The Pharmaceutical Society of Hong Kong, Mr. Dixon. Thank you, Chairman. We support the law. A safety net should be cast to protect children, but for pharmacists, they are mandated reporters. We are confused. There are a number of different types of pharmacists. There are some educators, some work in pharmaceutical companies. For educators, they do not come in contact to children during their day-to-day work. For pharmacists who work in dispensaries, they don't come into contact with children either. For pharmacists who work in the hospitals, they may infrequently come into contact with children, especially with those who have been hospitalized, but the frequency and scope is extremely limited. For community pharmacists, unlike other professionals, we are unable to get any information from the children or relevant families. If we are to be made to make a report, we are unable to include any relevant information in our report. We are unable to retain or remind the children in our pharmaceutical companies when we identify some bruises, for example, on the children when they come to purchase drugs. when we come across such cases, we do not know how to handle them. Pharmacists are not professional psychologists of children or pediatric psychologists. If we are to implement the regime, I think that we should have training for mandated reporters. Such kind of effective training have to be made mandatory, because some people may say that they don't know how to detect child abuse cases. Pharmacists do not come into contact with children very often during their work, and they don't have relevant knowledge to assess the psychological status of children. Because we are registered healthcare practitioners, that is why we are put under this list of mandatory reporters. I think that it will be very difficult for us. And we will be subject to criminal liability. If we commit any offense under the bill, we will be subject to liability. Next, we have from the Hong Kong Department of Health Dental Therapists Association, Mr. Lo Kam Shing. Thank you, Chairman. We work in the Department of Health. There are over 290,000 children who come to us for checkup. Those children aged from 6 to 12 approximately. And we cater to the needs of children with special needs, and we provide services to them up to the age of 18. We have the following concerns despite our support of the bill. I think that we should set out very clearly the definition of serious harm along with the procedures of reporting. During our work, parents come with their children. I believe that all of us have gone to their dental appointments. Most of them who come to us suffer from diseases or dental discomfort. We saw parents imposing corporal punishment in the clinics. Sometimes the parents ask their children to go to the toilets and slap them or scold them. Is this a form of child abuse? We have to define it, because children are not adults. If they have to come for dental appointments, they will feel discomfort. And because they are forced to come, they will throw a fit. And sometimes when their parents see that, they will slap them or scold them. It's not that we don't want to make a report, but we come across difficulties and different scenarios at our work. For light punishment, we may try to comfort the parents and children to mitigate the situation. Under such circumstances, when there is light punishment, and sometimes we have other parents who see the situation and they may make a report. If that's the case, then we may be said to have been failed or have failed to make a report. Please make a brief conclusion. We think that the penalty of imprisonment is too harsh. And we should provide training to healthcare professionals, because in our professional training, we are not taught how to identify child abuse. If you have any submissions, please provide them to us later on. Next, from the Hong Kong College of Community Health Practitioners, Dr. Tong Kar Wai. Good morning. Thank you, Chairman. Hong Kong College of Community Health Practitioners in principle support the spirit and rationale of the bill. We have a few suggestions.
First, clause 4, bracket 1 of the bill. We can see in some cases children or patients in need may need assistance by non-professionals, say for going to the bathroom. And only then the non-professional find some injuries on the child. But then if these non-professionals are late in reporting to the professionals, then who should be held liable? Second point, clause 4.5, as some other deputations mentioned. We need to consider the question of proportionality for the penalty. We are healthcare professionals. Rarely will we be facing severe punishment, criminal punishment, say manslaughter. But then in this bill, there's no definition for mens rea. I think that's something that needs to be clarified. It just says in the bill that if it's a failure to report, it's a criminal offence. So we need to consider the gravity of the act, and there's need to be more explanation. And then clause 7, the bill says that there will be a guideline. It's probably like a code of practice. But if it's a code of practice, no, perhaps we'll think it's more formal, and then we'll give it more weight. So instead of guidelines, perhaps a code of practice is better. And then clause 9 is about the culture of organization. Very often, when a frontline professional wants to report a case to the police, they will seek help from another department, for example, the Security Bureau. Clause 9 is about reporting a case to the supervisor. But then at the end, the supervisor chooses not to report the case to the police, and that supervisor is not a mandatory reporter, then what will happen? And then clause 11. Just now a few representatives also mentioned this point. The relationship between the parents and the professionals. Now, we're concerned about that, because if we have to report, we're mandated to report a case, then it's most likely that such a relationship will be destroyed. And then what do we do? And then Schedule 1, there are many different types of mandated reporters. So how are the different bureaux going to work with each other? For example, nurses in the private sector, I would see some problems there. Thank you. Next. Ms. Ho Kar Wing from the Association of Hong Kong Nursing Staff. Good morning. I'm here on behalf of the Association of Hong Kong Nursing Staff. We believe that one child abuse case is one too many. And that's why we are all for legislating for the mandatory reporting of child abuse. It's a very important move in protecting children. And then we could also hold perpetrators to account. Now, we conducted a survey among our members, and as a result, we have 3 suggestions. 1, we hope there will be a clear reporting process to follow, and there should be different grading of cases. Because colleagues are concerned if we have suspicion, and now there is not yet a clear guideline, so we don't know what the reporting process is like. So there needs to be clear specification of the reporting process for practitioners to make report quickly. And if there's a guideline for different grading of cases, it will help us to decide the gravity of a case. This will help frontline colleagues to do some risk assessment. And certainly there should be real cases in training that will help us learn more. For example, for colleagues in the accident and emergency departments, we need to help them to have a stronger awareness in identifying cases, and then the training should use real cases, so trainees will know how they should handle different cases. That's the second point still. And third point, we need to give protection to mandatory reporters. Well, the bill says no one must obstruct reporting, but still colleagues may have concerns. If, say, I report a case to my senior, the senior may adopt a passive attitude or may even try to press the colleague, and the colleague may dare not report a case, and then that colleague eventually will be held criminally liable. So reporters must not be obstructed. At the same time, they should be given full support and protection. There's need to give legal support to colleagues when necessary. There could be other protection measures too. So the mandated reporters will be able to make the report without fear and or concerns. Now, there's need for collaboration and support by different professionals. The government also has a role to play. So there's a need to provide comprehensive support service. And so we won't see child abuse cases anymore. Thank you. Next, Dr. Sandra Zhang from the Hong Kong Institute of Clinical Psychologists. Good morning. I'm Dr. Sandra Zhang of the Hong Kong University. I'm attending this session with various capacities. I'm a member of the Children on Commission. I'm the president of the Hong Kong Institute of Clinical Psychologists. I'm also a registered social worker, and I'm a scholar. And of course, today I'm here to represent the Hong Kong Institute of Clinical Psychologists. Now, we believe with this bill, then we could enhance the alertness of professionals to protect children from abuse. In fact, it's already had such an effect since the introduction of the bill, or even since the discussion of the matter. And in the past few years, I see that the government's actually listened to the views of the different stakeholders and responded to them. And the government has tried to strike a balance and then is trying to come up with support measures as soon as possible. For example, increasing number of child care residential places and giving more support to different centers and so on, and also offering information on real cases for training purposes. So we commend that effort, but still we need to pay attention to a few points first. There must be timely report of child abuse cases, but then we must always put the child's interest first. Some have suggested we should listen to the voice of children. Well, we've heard that. In this reporting process, children have expressed their concerns and anxiety, so we need to give children proper protection. At the same time, we must not overlook the importance of prevention and public education. So we should go one step further or earlier in protecting children. And then there's a need for professionals to keep in good relationship with family members and parents, so then they'll be able to assess the case properly and handle it properly. So what is the best timing for reporting? There is no set standard. We should leave it to professionals to make the judgment. And thirdly, the support measures should include accurate reporting. The accurate reporting means that there must be precise definition that's easy to follow. So the government should involve different professionals on training. And the second point is about efficient handling of reports. So that means we need a lot of manpower. Okay, the resources are there and the posts have been created, but do we have enough staff? That's the challenge. Now, if there is not enough staff, the government still must not relax the requirements on training and certification. Still, you should increase the number of training places proactively so we have a steady supply of manpower. A third point is about increasing the quality of residential care services, enhancing support for families and so on, and also other services such as rehabilitation service, marriage counseling, and so on. All these services need to be enhanced so we have comprehensive support for for healthy families. Thank you. Next, Xinhua Herbalists and Herb Dealers Promotion Society, Ms. Wang Suk-yi. Thank you. Good morning. I represent the Xinhua Herbalists and Herb Dealers Promotion Society. I'm here to give our views. Now, what is the definition for child abuse, and clinically how do we assess if a child is abused? We hope there will be some provisions to exempt liabilities, because for Chinese herbalists we may not have enough contact to tell if there's an abuse case. And then could there be departments or hotlines for us to call so we could find out about available support, and then perhaps there could be case examples too for us to refer to. Thank you. Next, Miss Valerie Chu from the Chiropractors Council. Good morning. The Chiropractors Council is in support of the bill, but then chiropractors are mostly in private practice, and the information given by the patient may not be accurate. And if after patients left and the chiropractor wants to report a case, but because there's inaccurate information, we're not able to trace the patient, then would it be regarded as a delay in report? Will it be punished? And then sometimes there's just one treatment session, or there may be multiple treatment sessions. Are we required to identify child abuse in one treatment session? And also there is not enough training in this respect, and then we may also not have too much contact with the patient. So should we still be required to report cases, and because the penalty is severe? We are concerned about abuse of the reporting mechanism, and if there's wrong reporting, would the sector be punished as well? Now, there are no precedents, and say if a chiropractor is punished with fine or imprisonment, then what about the registration of the chiropractor? When will there be disqualification? There are no precedents to go by, and there's no guideline. So could you give us more support, say, giving us guidelines? And if it's about registration or the practice license, well, perhaps there's need to amend the relevant legislation for the different healthcare sectors. Can you really complete everything in 18 months? That's our worry. That's all I'd like to say. Thank you. Next, Union of Hong Kong Speech Therapists Medical, Ms. Fong Wing Si. Thank you. Good morning. I'm the president of the Union of Hong Kong Speech Therapists Medical. I represent colleagues working in the Hospital Authority and the Department of Health. And colleagues are worried. Why? Because for speech therapists, yes, we just take care of the speech capacity of children. We may not be able to see any physical injuries on the child, and we won't ask the child to show us his arm or his leg in the course of therapy, and so colleagues are worried that there may be wrong reporting as a result. And also, when we're doing training with children, usually the session may not be too long, and the mother or the parents want the child to work with us. And what if the parent then slaps the child, for instance? And what are we supposed to do? We want children to be cooperative, but then if a parent, say, slaps a child, do we have to report that? So colleagues are not sure. Now, we work in hospitals. Perhaps we could be given training, but that may not be sufficient probably, because we need real examples. We don't know whether a case should be reported or not. So, so with the enactment of the bill, I hope we'll be given more real case illustrations, so we'll know if we should report a case or not. And could there be an inquiry hotline? So if we have questions, then we could have someone answer our questions. Maybe there could be a checklist or flow chart, so we know what the process is like and what we need to follow. Could there be, say, a scoring system, and then we'll say, okay, now this is probably a child abuse case, or if we know that this is not the harm referred to as serious harm. So we need a checklist because our professional training is not about that, and we really do not know where there is an abuse case or not. But on the whole, the union supports the bill because we believe children need to be protected. Thank you.
Next, from the Hong Kong Institute of Speech Therapists, Dr. Ng Ho Yi. Thank you, Chairman. Speech therapists work in different organizations, including schools and hospitals. The Hong Kong Institute of Speech Therapists support the bill, and we have a few suggestions relating to the bill. First, we think that we should have a clear definition on child abuse, because there is no clear definition of serious harm. Speech therapists are unable to identify child abuse during their work, and in clause 4(3), it says that there is a concept on adding to the extent of harm or degree and extent of the harm. Is this a necessary or sufficient condition of serious harm? We think that we should provide for a clear definition of serious harm. For instance, in offenses against the person ordinance, it specifies unnecessary suffering or injury to his health includes injury to or loss of sight or hearing or limb or organ of the body or any mental derangement. We notice that in relevant legislation in Australia, they define abuse, including physical abuse, sexual abuse, and emotional abuse, with concepts of emotional abuse. We also think that we should revise the exemption provisions for child abuse. We see that in the bill it says that professionals are not required to make a report if they honestly and reasonably believe that the harm was caused solely by other child or children who is not responsible person. But a child abused by children with different power differentials can include harmful acts other than sexual acts. And we think that we should revise the relevant exemption provisions. Next, we think that we should add some defense provisions. The bill states that the professionals may raise only 2 defenses, including having made the report or honestly believe that another professional have made the report. But these 2 defenses do not cover other reasonable circumstances, such as situations where making a report would jeopardize the safety of others, or suspicion of child abuse cannot be confirmed based on observations and medical history during the clinical encounter. We hope that we can add a defense provision of the professional had a reasonable ground not to make a report. Lastly, on clarification of post-reporting protection, because this bill prohibits anyone from disclosing the identity of the reporting professional, but in our work settings, we may self-disclose our identity as a reporter. To alleviate the concerns of the profession, I think that we should clarify the scope of self-disclosure or the scope of post-reporting protection. And we hope that the bill can be revised to achieve the policy objective of the legislation. Thank you. Next, from the Hong Kong Clinical Psychologists Association, Dr. Edwin Chin. Thank you. Good morning. I would like to provide some views on behalf of the Hong Kong Clinical Psychologists Association. We hope that there can be a clear guidelines for professionals. Sometimes psychologists do not work with children. They may work with their carers or parents. In the process of consultations, they may reveal that they have beaten up the child, or they may reveal that the partner have imposed corporal punishment on their children. Should we be held liable? Do we have to make a report even though we have not seen the child involved? Some psychologists may be able to conduct assessment and come in contact with children. Such kind of assessment, can they constitute reasonable or necessary action as stipulated in the legal defense? Sometimes parents don't want to harm their children. That is why they come to us for therapy. As psychologists, we think that we should provide treatment to parents instead of reporting on them. Should that constitute a defense in the bill? We hope that there can be more examples provided for in the bill. On Schedule 1, the list of mandated reporters, as there is not a registration for a clinical psychologist. That is why in Part 1 it says that a person who professes to practice at or publishes his or her name as a clinical psychologist, audiologist, dietitian, educational psychologist, and speech therapist. It's not ideal for the provisions to be written like that, and we think that there should be a professional registration mechanism for clinical psychologists. Sometimes some clinical psychologists do not profess as a clinical psychologist, and they may adopt other wordings in their titles, and when, for example, when they work in different capacities. This may create a loophole for our colleagues to evade their legal liability or responsibility. We think that there should be a registration scheme under the hospital authority to promote a statutory registration scheme under the Department of Health. Thank you. Next, from the Hong Kong Social Workers Association Chapter on Medical Social Work, Ms. Kar Chung. Thank you, Chairman. Good morning. I represent the Hong Kong Social Workers Association Chapter on Medical Social Work. Through mandatory reporting of child abuse, we think that we can raise the awareness of the community in protecting children, and that we can intervene and identify child abuse cases early to protect children. We have the following suggestions and views. We think that the definition of children as someone aged under 18 is appropriate, because if we make a definition of such, we can protect children. For serious harm and real risk, there should be clear definitions of them, and there should be guidelines. We think that there can be assessment tools so that our colleagues will know how to identify child abuse cases, to avoid over-reporting or misreporting, to focus our resources in protecting children with actual need. And it says that we should make a report as soon as possible or as soon as practicable. We hope that we can have a clear number of days set out in the bill, say within how many days should we make a report, so that we will not fall foul of the law. We hope that there can be clear guidelines. On increasing the resources for emergency placement of residential childcare, we believe that during the initial stage of the passage of the bill, there will be an increase in number of cases. Sometimes children have to be hospitalized. If after hospitalization they are assessed to be unsuitable to go back to their home, social workers will arrange for placement. The social welfare departments say that they will provide emergency placement, but we think that it is insufficient, especially with children with special needs and newborn. We hope that we can have more resources for this kind of children. And we think that we should have more community publicity and education to raise the awareness of child protection among members of the public. We hope that the number of child abuse will go down after passage of the bill, and we also think that we should enhance training for social workers, because once they graduate, they have to take care of these cases. Hopefully, in the tertiary education, they can receive relevant training on child abuse so that they are more confident in handling relevant cases. 25 types of professionals are included. We hope that there can be a list stipulating the names of the professionals, because we don't know whether someone is a specified professional. Thank you. Next, from the Hong Kong College of Emergency Medicine, Dr. Wang Cheng-yin. Thank you. I represent the Hong Kong College of Emergency Medicine. Our college supports the mandatory reporting of child abuse bill. In ANE, we come across suspected child abuse cases all the time. Children seek help from doctors in ANE, and we support them all along. But we have some worries and concern for special cases and mental cases. ANE is often very busy. Sometimes we don't have time to investigate into a case to make an accurate judgment. We are worried that we may be held criminally liable because of that. Some children may suffer from some mental disabilities, and if they play and suffer from bone fractures, we don't know if they have been abused. But we are worried. We try to make a report, but we hope that more considerations can be given to this area. We don't have anything else to add. Thank you. Next, from the College of Nursing Hong Kong, Ms. Ellen Koo. Thank you. Good morning. I represent the College of Nursing Hong Kong, and I have a few points to make. Our college supports the bill, but in terms of execution, well, we will be actively participating in making reports. We hope that there can be clear guidelines and procedures in various units and organizations. And in terms of responsibility, nurses work in different capacities. Sometimes supervisors or colleagues do not agree with us, and the reporters may be made to work in an uncomfortable environment if they do make a report. And in the law, it says that we are prohibited from disclosing identity of the reporters. But nurses work in public settings, in clinics and hospitals. And they may be harassed after making a report, and we should try to avoid that so that reporters can work in a safe environment. And it mentions that placement will be provided to victims. But apart from providing placement, we hope that other forms of support can be provided to the children who have been abused so that they can grow up happily. In terms of training, we have a large number of nurses in Hong Kong, and they work with other healthcare professionals. We hope that publicity can be enhanced so that nurses can receive sufficient training before they have to carry out their mandatory reporting duty. Parents and families need support as well. Apart from taking care of the children after they have been abused, perhaps we should work with community organizations to promote healthy family so that children can grow up in a healthy community. Thank you. Next, from the School of Nursing, the Hong Kong Polytechnic University, Dr. Joyce Chung. Thank you, Chairman. Good morning. I represent the School of Nursing, the Hong Kong Polytechnic University. Our school support the mandatory reporting of child abuse bill. We have one suggestion. We hope that we can enhance the training on detecting child abuse cases and formulating different levels of abuse for students of nursing so that they know what kind of care to provide to children at certain stage of abuse. Because apart from physical harm, we have to cater to the mental needs of children as well. We hope that there can be some screening tools on mental capacity and physical conditions of a child so that we know when to make a report and to provide support to them. As healthcare professionals, we have to speak up for children. As professionals, we have to teach students of nursing so that they create a healthy environment for children. Thank you. Thank you, Dr. Chong. Next, from the Chiropractic Doctors Association of Hong Kong, Dr. Eric Chu. Thank you. The Chiropractic Doctors Association of Hong Kong supports the government in legislating the bill. As chiropractors, we treat diseases in relation to bones and skeletons and musculoskeletal structures. And we are happy to offer our professional advice and contribute. But child abuse cases are very complicated. 100% of the chiropractors are in private practice. So we don't have the support of a professional board or organizations. Chiropractors often only work with a nurse. So we think that there should be an objective and clear guidelines for chiropractors so that they can gather evidence to make a report. 100% of the chiropractors receive education overseas before coming back to Hong Kong to register for their practice. In international chiropractic education system, we don't have a systematic ways to teach chiropractors on detection of child abuse cases due to different cultures of different countries. Our consensus is that we will rely on objective reports, including radiological reports or X-rays. We hope that in the mandated reporter's guide, there will be a clear methods of training and guidelines. Thank you.
Given our workplace, it's hard for us to, assess the condition of the more private parts of the body, and there's no code of practice in that respect. So we don't have sufficient training on mental status and so on. We hope the government will give a comprehensive guideline More importantly, there has to be sufficient training, and time must be allowed for the sector to be prepared. And it may be such guidelines should also be included in our continuous professional development courses. Then they must be made a mandatory course training. Well, the Academy of Chiropractors has just been set up, and then maybe this should be included in the training as well. But in conclusion, we are all in support of the bill. Next, Hong Kong Association of Educational Psychologists, Mr. Choi Poi Kee. Good morning. I am here to represent the Hong Kong Association of Educational Psychologists. We welcome the bill. On this bill, we have collected views from our frontline members, and 90% of those interviews say they do not know much about the bill or only have little information about the bill, and 70% of our members are worried that after the bill is passed, that it will add to their workload and there will be more tension between them and parents. So as frontline psychologists, we have concerns. Now, usually, educational psychologists will only go to school once or twice in a month, and then there are many other stakeholders involved in the process. So, we want to know exactly the role of educational psychologists under the bill. We hope there will be clear guidelines for reporting, and there must be real case illustrations for our reference. And then what about our collaboration with others in the school? We need more information on that too. And in the reporting process, I wonder if there will be a multidisciplinary reporting platform. And we will be given legal advice and support before we make a report. And after the bill commences, we hope there will be a department that will keep in communication with us. This will provide support to our sector. There's need for talks, workshops, training, and detailed guidelines and so on. So for information on the bill, the role of team members, follow-up measures and so on, we need information on all aspects so we will know exactly what the role of educational psychologists is under the bill. In conclusion, we want the administration to clearly explain the roles and obligations of different parties, what the risks are, and whether there's training and so on. We also would like to be given legal support too. Thank you. Next, the Hong Kong Academy of Nursing, Ms. Ma Po King. Thank you. Good morning. I represent the Hong Kong Academy of Nursing. We support the bill. Now, with the passage of the bill, or since the bill's been introduced, we would like to express our concerns. First, we see that there is now more understanding about protecting children among the public. We see more children living in homes, and after the passage of the bill, we are concerned that there may be even more children staying at homes. So for the reference service providers, they need to pay attention to case management and welfare arrangement. We don't want the time taken to be too long. Otherwise, there will be undue pressure on the families, because if the whole arrangement is uncertain, then the whole family will be very worried. And then it's important that we give good psychological support to children. Now, children mature early these days. They are worried whether they will be able to go home or they will be put in a place that they are unfamiliar with. So they will be worried. And that's why there's need to keep explaining the arrangement to children. And third point, additional foster care places or emergency residential care places are needed, as some suggested just now. if children stay at hospitals for a unduly long period, they will increase their infection risk and so on. And if it takes a long time for welfare arrangement to be made, then for frontline workers and parents there may be conflicts actually, and that will be a pressure on our frontline staff. Training is of course very important. For in-service training, we hope that will be enhanced for colleagues so they come to learn about the bill, and then it will be they will be able to handle cases more efficiently. Thank you. Next, the Society of Hospital Pharmacists of Hong Kong, Mr. William Choi. Good morning. The Society of Hospital Pharmacists of Hong Kong supports the mandatory reporting of child abuse bill because this is very important. We need to protect children. They are our future. So there is a ethical duty both for professionals and the public as a whole. In fact, in other places like the US and UK, they already have mandatory reporting regimes in place. We know the government would like to widen the protection web. And from overseas experience, why is it that pharmacists need to be included in the list of practitioners or specified professionals? Well, we have pharmacists at clinics, at hospitals, and in pharmacies even. In some cases, pharmacists will be able to help. For example, when parents refuse to prescribe prescription medication, or maybe parents ask for drugs like for treating mental illness or twitches and so on, then that may be signs that there is abuse. Or if sometimes parents refuse to seek treatment, they just buy bandages and disinfect and so on, then or sterilizing agent and so on, then maybe it's also signs that there's a physical abuse of a child. Now, of course, we know the sector is concerned about the details in particular. There is criminal liability, and you know that will have impact on a professional's future. So we know for certain professions there's need to be in place a registration system, and then the professions will be able to play their role in protecting children. Now, training, guidelines, reporting mechanism, legal support, and education are all very important. The government needs to give support and training to professionals for them to play their role. Now, we are glad to see there are clauses in the bill to prevent the obstruction of reporting. Yes, we've seen such cases, especially in the public sector, but the guidelines must be clear enough so we know what exactly constitutes obstruction. Or should we still first complete our clinical work before we report? Well, we need specific guidelines on all these aspects. Thank you. Next, College of Surgeons of Hong Kong, Dr. Chen Hao Yi. Good morning. We are surgeons. I'm a pediatric surgeon. Yes, I do come in contact with many child abuse cases. So what are our concerns from the clinical aspect? There is a need for a clear definition of child abuse. Now, we have seen many child abuse cases. Some of them are rather minor in nature. So that's why we won't be able to identify these cases in the first treatment, in the first session. And we worry if then we will be deemed as having failed to report a case. And we're just talking about physical abuse, and then we've seen many mental abuse cases, or verbal abuse even. And it's not easy for us to define if it's abuse or not. And there's also mention of who should be held liable. because in our case, often we work as a team to treat a patient. You know, there are colleagues from the accident emergency department, and then they come to us. There are teachers, there are doctors, there are nurses, and so on involved. So who should be held liable? Is it a collective responsibility, or rather, if we have suspicion, who is responsible for reporting the case? And sometimes we don't want to do it. We are more than prepared to do it. We just want to clarify the liabilities and the actual implementation arrangement. Now, as some have mentioned, how do we find out if a case has been reported already for the patient? Now, when we have suspected cases now, we would contact the social worker, because they will usually have been following up on the case. And then, of course, for social workers, they may have many cases at hand, so they may not be able to tell us very quickly that a case has been reported, so we don't need to report it anymore. So how do we find out that? And support. There's mention of hospitalization. Well, if we put a child in hospital, that means separating the child from family members. This is one option, but are there other intermediate options? Usually when you're trying to take a child away from a family, there could be violent behavior. It happens in the wards from time to time. So could there be some intermediate support? Thank you.
Thank you, Dr. Chen. Next, we have from the Hong Kong Society of Professional Optometrists, Mr. Lim Man Hoi. Good morning. I represent the Hong Kong Society of Professional Optometrists. I represent 700 optometrists that accounts for 1/3 of the registered optometrists in Hong Kong. As professional optometrists, we come into contact with children very often, and we think that we have to protect children and accord priority to their interests. Here, I would like to take this opportunity to talk about a few points. First, we hope that while we are protecting the rights of children, we have to review if the legal liability to be borne by mandatory reporters is too harsh, because criminal record may lead to revocation of professional license, and it will increase the burden of frontline healthcare professionals. There could be over-reporting if healthcare professionals are worried of committing an offense. And it may result in the case that we try to avoid criminal liability by making a report instead of to protect the children. When we come across a large number of child abuse cases, we may miss out some of the cases that need attention because of the lack of resources. The provisions of the bill target serious harm. What is serious harm? And physical harm or injuries may be easy to detect, but how should we draw the line on mental abuse or mental harm? We understand that neglect is also a form of child abuse. In some cases, we notice myopia, and if they are not cared for, it will result in permanent, irreversible impact to the children. Does this constitute a serious harm? Optometrists as primary eye care worker do not receive relevant or sufficient training of child abuse. I believe that most optometrists do not know how to handle the case when they come across one. So we think that we have to formulate details on the training and execution. And we hope that the administration will provide advice on training. How can we formulate a reasonable training for mandated reporters if we do not engage the relevant healthcare professionals? We believe that mandated reporting regime can protect interests of the children. Through a reporting mechanism, we can detect child abuse cases and make contribution to create a safer, healthier environment for our children to grow up in. I hope that the administration will consider our comments. Thank you. Thank you, Mr. Lam. Um, 28 said that they would come, but only 25 have come to make their representations. If the remaining 3 representatives can arrive in time before the end of the meeting, I will allow time for them to speak. Now we invite the government officials to respond. If members would like to put questions or make comments, please press the Request to Speak button. I will first invite the Undersecretary for Labor and Welfare, Mr. Ho, to make a response. I hope that the government can respond to these 2 points. By end October or early November, I understand that the government has given the healthcare professionals an invitation letter on formulation of a mandated reporter's guide. I wonder if the professional bodies here have received the relevant invitation letter for them to give their views. There are 25 bodies in the healthcare sectors have spoken, but in Schedule 1, specified professionals, there are some groups of professionals who are not here in the public hearing. I would like to know if the government understands their views, including the midwives and the medical laboratory technologists and radiographer, physiotherapists, and dietitians. I would like to know if the government has reached out to these professionals and gauged their views. Thank you. Mr. Ho, please. Thank you, Chairman. Let me first respond to your questions, and then I will invite Mr. Lee from the Health Bureau to talk about the collection of views and the views of the professionals that you just mentioned. I would like to thank the 25 representatives from the sector to share with us their views. We note your views and we will consider them seriously. As mentioned in my opening remarks, we would like to create a safety net for children. Instead of a rope, we want to create a net, because a rope is created by one person, but a net is created by a group of people, because no one professional can cater to all needs of the children. So different professionals can look at relevant cases from different perspectives. Say physical abuse is easily identifiable. But if in the children's system there is a high density of heroin, it may not be able to be identified on the surface. So we need different professionals to become mandated reporters. We already have a system to cater to the needs of children in terms of serious harm. We have a multidisciplinary platform. By legislating, we hope that when professionals come across a serious harm in children, or when they notice that the children is at real risk of suffering from serious harm, they can make a report so that the multidisciplinary case conference can take care of the case instead of referring the case to the social worker. The multidisciplinary case conference comprises the police and social welfare departments and so on. So when professionals become mandated reporters, if they identify cases, say for surgical nurses, when they come across injuries on children, and say when the pharmacists identify concentration of drugs in a children or in a child, they can make a report. So we want to cast a safety net instead of creating a rope so that children can be protected. We state reasonable ground in the law, because if professionals have reasonable ground to suspect cases of child abuse, they can make a report. After receiving your views, we have amended the law by stating that a report only have to be made when they notice serious harm or notice real risk of suffering serious harm. We think that it's difficult for us to further differentiate different forms of serious harm, because we already state that it's serious harm in the law. That's our first point. In terms of training and real case scenarios, in terms of training, I will invite the Social Welfare Department to respond to that question. Under what circumstances should professionals be made to report? I understand that you refer to your professional code of practice very often, but we have made reference to the relevant guide in other jurisdictions. So we'll put in real case illustrations in the guide so that you will not rely only on the definition. With different sectors, including education, social welfare, and healthcare, we are collecting views. Mr. Lee, Principal Assistant Secretary for Health, will supplement. There are 3 stages of consultation. We have already sent out invitation letters to collect views from different sectors to collect cases of child abuse. We would like professionals to provide us with the real examples that you have come across. By early next year, we will establish 3 professional groups or 3 professional consultant groups, including professionals from the social welfare, education, and healthcare sectors. So that they can have a focus group meetings on real case scenarios and the questions and inquiries that you have put in phase 1 of the consultation. So if you do not provide us with the examples of a potential child abuse that you have come across, it's difficult for us to discuss whether certain cases constitute child abuse in our focus group meetings. So in the first quarter of next year, we will have focus group meetings with the views from the professionals. We can formulate the mandated reporter's guide. We undertake that from Q1 to Q2 next year, we will have a skeleton of the guide for the scrutiny of the bill. In stage 3 of the consultation, we will be at the time after Gazetted of the bill until to the 18-month transitional period. We will continue to talk to the professionals so that we can complete the mandated reporter's guide before the end of the transitional period, and before the law comes into effect, we will provide training to mandated reporters. Hopefully we can achieve that before the law or bill comes into effect. Now I will invite the Social Welfare Department to talk about the training, and I will invite the Health Bureau to take other questions. Perhaps a supplement on the issues of training to complement with the bill. There are quite a number of professionals involved, so we will have an online learning platform so that professionals can take courses online whenever they are convenient to provide training to professionals. We have large number of information or resources online. We have a self-learning course and webinar in the platform. There are 2 modules of the self-learning courses. The first one covers basic knowledge on child protection. The second module covers legal provisions and procedures for reporting of the regime. We will not wait until the passage of the bill to promulgate Module 1 because that's on protection of children. But as Module 2 covers the law, we will only roll that out after passage of the bill. Apart from self-learning courses, through webinars, we will provide talks to professionals, and we have different themes for us to talk about different scenarios. And we will have a Q&A sessions in the webinar so that we can learn from each other. On the online learning platform, the professionals can watch the webinars after it's happened so that they can undergo training at a time when they are free. Apart from online learning platform in various bureaus, organizations, and departments, we already have training, and they are already providing them. Cover trainings, protection of children, and various aspects. We believe that the relevant bureaus and departments will continue to provide seminars, workshops, and online courses for professionals so that they know how to handle suspected child abuse cases better. Thank you. Health Bureau, please.
If I may give a brief response first, I would like to thank representatives from the healthcare sector for their views. I'm glad to have this opportunity to hear their views. In 2021 and 22, as the Undersecretary for Labour and Welfare said, we invited submissions from professional bodies. So this is another opportunity for us to hear the views of the sector. The chairman referred to a number of sectors. In our 2021-22 consultation exercise, we did seek views from the bodies you mentioned. Some of them are not present here, but we've actually invited written submissions from them during the consultation period. Well, everyone actually supports the mandatory reporting proposal, and they support the principles of protecting children. But on the actual arrangement, there are different views. For example, for the 2 groups you mentioned, they question whether they are the professions that have frequent contact with children. They have reservation about that. And also on the reporting threshold, and whether there's need to do certain examinations before reporting, well, they have views on that too. As for multidisciplinary collaboration, what is the reporting process and mechanism? Again, their views from the groups, and the World Health Bureau is well aware of these views. Now, the whole purpose of the bill is to have early identification and intervention. We all agree, but when it comes to implementation, there are different views. We are now preparing a guide, and we are seeking the views of the professional sectors. In fact, in October, December, November, we already wrote to the different professional groups. Now, for all the councils and professional institutes, they have received our letter. We asked them to reply in December, so there's still time. And we've actually written to all the relevant professional sectors. If there are institutes who are present here but they have not yet received a letter, we will send them the letter and seek their views. It's fine because there's still time. Well, you know, the nature of child abuse cases may vary, and the level of gravity may also vary. But then we've covered all the professionals who may have contact with children. And these are professionals, you know, under a certain degree of supervision or regulation. But then, yes, we appreciate some of the professions may not have frequent contact with children, but because of their work nature and their workplace, they do provide services to children. So we cannot rule out the possibility of them coming into contact with children because we want to protect children. And so under this guiding principle, we believe all healthcare professions should be included on the list. Now, these healthcare professionals, they are usually work as a team. They are used to that approach. So, you know, they do come into contact with children to some extent. Now, when there is multidisciplinary collaboration, what is the reporting process like? Yes, we know there are concerns there. The hospital authority will formulate guidelines to help different healthcare discipline to report cases. This is to avoid duplication of reports. And then other professions may know whether a case has been reported or not. And of course, there could be sharing of experience with other professional groups and bodies. Now, the social work department just mentioned a platform. The hospital authority will also be providing training to their staff. Finally, on the formulation of the guide, we mentioned that in October we sent out invitation letter inviting the different professional disciplines to give us real-life cases and scenarios. And then early next year we're going to set up an expert advisors panel, and we'll invite them to more in-depth focused discussions. Of course, different groups gave their views today. Before mid-December, we welcome views from them still. And then next year, after we've set up the expert panel, we will continue to welcome views from the various professional bodies because they will form the basis for preparing the guide. And I understand the guide has some legal power under the bill. Hospital authority, anything from you? No? In that case, I now open the floor to members. I'll read out the list. Reverend Peter Kuhn, Ms. Lillian Kwok, Dr. David Lam, Mr. Chi Kwok, Mr. Lai Tong Kok, and finally myself. 5 minutes each. Reverend Peter Kuhn. Thank you, Mr. Chairman. You know, this is an ethical issue, is taking the ethical high ground, so no one will oppose to protecting children. But then for every organization that comes to give their views, there's always a but. So there are certain conditions to their support because they're worried. Now we are the Legislative Council, so we're here to make laws. But will making a law help the situation or not? Especially for healthcare professionals, they will be under immense pressure. Let's say if a child goes and see a doctor, or we heard from some dentist here, they're worried in future. When a child comes to see them, do they first check whether the child is fine or not before giving treatment? Now, well, this is an open hearing, so maybe there are certain concerns they won't express here. But I understand behind the scene, many have expressed views on the bill. As I said, this is it's about moral high ground here. Now, I think healthcare professions, I think you're including too many of them. They're not the same as social workers, for instance. And some groups say, are they supposed to check whether a child has injury on his arm or leg before he gives it he gives him treatment? And then there's mention of training. Now, I'll be candid. It's not an excuse, but it's another way to put it, perhaps. If you don't give me training, how do I know whether there's abuse or not? So I think, how do you want to proceed with this? That's really the question. You say there will be a mandated reporter's guide. Are you going to show us this guide after the passage of the bill? Could you do a trial first, a pilot scheme, and let the sector give their views, or give them time to try out the measures? Will you do that? Because everyone is being very careful. Now, the professionals have been here many times. No one wants to see any child abuse case. I can guarantee that. But then, maybe in the past, sometimes it's pure negligence that they overlook certain cases, but then there could also be misunderstanding. Now, we've seen the two tragedies involving children, but they were special cases. But now, is it the case that once bitten, twice shy? Are we now really overreacting? And what will happen after the passage of the bill? The government, on the part of government, is simple. Well, the bill is passed, so you have to do it. But then that's really a separate matter. And then for the healthcare group professionals, are we? Is it double penalty on them? Already there's the professional code. If there's a misconduct, they could be disqualified, and in severe cases they will be imprisoned. So is that too much? And also, we have to consider the mental status, because it's lengthy, usually it's a lengthy trial, and so what about the mental stress of professionals? And Mr. Chairman, is there any way to help healthcare professionals? We don't want this reporting regime to be a burden on them, because if a child comes to seek medical treatment, the doctor should focus on treatment. But then now a doctor may first have to check whether the child is showing signs of abuse. Otherwise, if I fail to report, I may be prosecuted, and that's the end of my career. So it's true. If you legislate, you need to make the cast the net wider so no one is left out. But is there really the way to help children? And before the law commences, are there ways to try out the guide to see if it really works? Any response, please, Mr. Ho? Brief one, please. Now, before the law commences, the mandatory reporter's guide will definitely be ready, and we will certainly be able to do what the members suggested. Now, members may just express views or put questions to the administration. You could also take this opportunity to put questions to the professional bodies here.
Mr. Lian Kwok. Thank you, Chairman. Of course, we all support the bill because we want to stand on moral high ground. But preparatory work is very important. We want to create a harmonious society and healthy families for children to grow up in. Only by doing that can we protect the children. But that's not the topic of discussion today. Before legislation, as mentioned by a number of deputations as we've gone through some public hearings, can we do publicity and promotion by organizing, say, seminars so that professionals can understand the bill more, to collect more views from them? Because we want to make the bill and regime detail in order not to affect the work of different professionals. Also, I think that we should formulate the mandated reporter's guide as soon as possible. As mentioned by Reverend Kuhn, maybe we can let the sector try it out first. Should we have different guide for different professionals? Apart from the mandated reporter's guide provided by the government, I think that different professionals can have their individual guide. Say, dentists focus on their children's oral cavity. Of course, if they notice that a child has lost his arm or legs, they will make a report. But for oral issues, maybe they can have an independent guide. I've come across some cases where parents force their children to eat certain things that affect the growth of their teeth or the health of the teeth. I will not go into detail, but I think that maybe we can have different guide for different professionals. Also, for a large number of professionals, say CPEP, they do not have any statutory registration scheme for them. They can attend workshops for half a year and profess as psychological therapists. And I do not see counselors in your list. I wonder what the reason is. For Catholic schools, they have counselors stationed at their schools instead of social workers, and more schools are engaging counselors at their school. If you say that you do not include this counselor in the list because they don't work in hospital, then do they not have to make a report? I think that they have a higher chance of detecting child abuse. Also, I would like to talk about levels of abuse and classification. Because you don't have different levels of abuse, unlike other countries, as long as you identify suspected cases of serious harm, then you have to make a report. But if professionals think that the harm is not serious, then they may not make a report because there is not classification of harm. I think that we have to clearly delineate between mild, medium, and serious harm. On mental health, mental abuse is a serious issue. Sometimes it's difficult for us to classify or identify relevant cases. This is especially important for A&E staff. I've come across cases where a father holds a knife at his hand all the time and asks the mother to finish all the housework. This is traumatizing for the child. When we come across such cases, how do we make a judgment? I hope that we can clearly define all these things before we legislate, and the government should communicate with the sector more. They have a lot of experience on how they classify whether a harm is serious, mild, or medium. Members, please allow time for the government to make a response. This is just a comment. Thank you, Chairman. As long as you have suspicion, there is a mechanism for you to make a report. But we want to make it mandatory legally that if professionals come across suspected serious child abuse, they have to make a report. This is a legal requirement. We understand that there will be more reporting after passage of the bill. That is understandable. For professionals that are not mandated reporters, they can still make a report, although they are not legally obliged to do so. Next, Dr. David Lam. Thank you, Chairman. I would like to thank our colleagues from the healthcare sector to provide their views here. I would like to ask the administration, if we are unable to identify the identity of the abuser, what should we do? Say in pharmacies, when pharmacists come into contact with a mother and a child, they do not have the ID cards of the mother. They don't know their identity. If they suspect that a child abuse case has happened, what should we do? Because we don't know the identity of the mother. There is a lack of consideration to teamwork of the healthcare sector in the bill. Let me name a real example. In A&E, a mother bring along her 12-year-old child at midnight. There is an injury on the child's left arm. The A&E doctor discovered that on the child's head, left arm, and leg, there is bruising, and there is insertion on the left leg, or incarceration. And when the doctor asked the child said that he sustained the injuries because of the injury from playing a football. And the mother said that the child are used to seeing private doctors, and they didn't have to wait so long to see a doctor. After X-ray, the doctor noticed that there is fractures on left arm and left leg, and the radiographer said that police has to be called because this is a suspected child abuse case. The nurse also think that is problematic because the mother has a very bad relationship with the child. But before the nurse can make a report, he was asked to handle other cases, so they did not make a report. The A&E also think that this is a suspected child abuse case, and they talked to the specialist doctor that this may be a suspected case, but the doctor or the specialist think that this is a natural injury from sports. So no one reported. And now there may be a failure to report involved. Under the bill, bone fracture is a clear child abuse signs. So being too busy is not an excuse for not making a report. So everyone involved, including the doctor, the specialist, the nurse, should be subject to legal liability. You do not need a specialist to see that there is a serious harm involved. For this, other doctors, they have asked all the information of the child because they know that the child plays sports, so it constitutes a reasonable excuse for the injuries. After consulting the trainers or coaches and the teachers, we may understand that the child actually suffered from injuries because of playing sports, and the case is not substantiated. If that's the case, what happens to the medical or healthcare professionals? And after that, the parents may pursue legal liability from the relevant healthcare professionals. This is a question of scenario. Thank you. I would like to thank Dr. Lam for sharing with us the case. We can discuss that in the focus group meeting of the professional panel. Dr. Lam gave us a very detailed case in healthcare settings. The hospital authority will streamline the procedures to make it easier for professionals to make a report. Dr. Lam's case is very useful. But we talk about reasonable ground to suspect. If the doctor know that the child plays ball games or cricket, it constitutes a reasonable defense. So at your position, if you think that there is reasonable ground to make a report, then you can do so. Thank you. Next, Mr. Chu Kwok-kun. Thank you for coming. I would like to thank the deputations for giving us their valuable comments and views. Some deputations mention psychological abuse. Because psychological abuse do not involve superficial wounds, I have a leaflet produced by the Social Welfare Department at my hand. It mentions the definition of mental abuse or psychological abuse. That is a leaflet on invisible wound, because sometimes there is no emotional signs on children who were subject to emotional abuse, so we should focus on the behavior of the children instead of their emotions or emotional signs. So we should make a judgment as to whether or not there is a child abuse based on the behavior of the parents. If the carers behave differently in front of different people, say if they threaten their child at home, while behaving very normally outside of the home, professionals may not be able to make a judgment as to whether or not psychological abuse is involved. We want to prevent failure or not reporting knowingly. Do we not have to cater to the needs of the child who are subject to psychological abuse? There are often signs in children who were subject to abuse. Should we just focus on the behavior of the carers? In clause 4, bracket 3, we mentioned the circumstances that may add to the seriousness of the harm or the act of omission that causes the harm, including which appears to be premeditated or which appears to involve threat, coercion, and so on. As mentioned, we always talk about reasonable ground. If carers or parents behave differently in front of the child and in front of other people, if outsiders or professionals do not see any problems on the outside, then this will not be a case where it warrants a report. As to how we identify such cases, we will work on that. But we believe that there is always chances for us to identify such cases. Chairman, perhaps we should enhance training to identify signs so that we can uncover such cases. Thank you. Any brief response? We note that, and we will adjust our training. Thank you. Next, Mr. Lai Tong Kwok. Thank you, Chairman. I would like to thank the deputations who have attended today's public hearing. Your concern and comments are very useful in our scrutinizing of the bill. A number of representatives, including but not limited to Dr. Wong, Professor Lau, Dr. Chan, Professor Tong, and Mr. Chui, they relayed their concerns on the legal liability of the regime. The administration responded to the concern. The government said that they will consult the relevant professional bodies in formulation of the mandated reporter's guide. After hearing from the deputations, some representatives talk about the key requirements under Clause 4 of the bill. When the government is explaining to the professional bodies the bill, they focus on the spirit and purpose of the bill. We all support that. But when we go into detail of the bill, it seems that the professional bodies are not very clear about them. Let me name an example. Clause 4, bracket 1 of the bill says that if a reasonable ground to when a report must be made is if a reasonable ground to suspect the following comes to the notice of a specified professional during the course of their work as specified professionals. Stresses a few work. The suspicion must come across during the work or the course of their work, and they have to comes to the notice of the specified professional. And in such conditions, a reasonable ground is generated. Then only then you have to make a report. Also, you have to fulfill certain conditions. A child has been suffering serious harm. When you see an injury on a child, you will have suspicion, but only based on that, legal requirements will not be triggered because there has to be suspicion of a child having been suffering from serious harm or is at real risk of suffering serious harm. A number of deputations ask about the definition of serious harm. The provisions or the clause states a real risk of suffering serious harm. What constitutes real? When the government is explaining to the professional bodies, they should clearly define these areas. The government said that they invite the professional bodies to provide views. Mr. Chu or Mr. Choi said that in this kind of mandatory reporting regime is common in other jurisdictions. I have done some research in Australia. They have different regulations in different states of the country. And in the regulations, they have different scenarios and levels and what should be done under certain circumstances. They are clearly set out in their guide or regulations. When the deputations are talking to the government, I hope that they can get the relevant information. Hopefully, the professional bodies will have a better grasp of the bill. Chairman, please allow me to finish.
Well, for example, West Wales, the South Wales of Australia, they have a procedure. There's a paper, just 10 pages. So it's the policy and procedure for child protection. So they have a detailed policy, and they use simple language to explain to you what is harm, what is serious harm, and what is reasonable suspicion. Everything is spelled out clearly. So in future, when this bill commences, maybe you want to propose certain points to be included in the guide, or there's need to change anything, well, your views would be of great value. So I hope when the government continues to consult the sector, you will compile the information received, and then you pass it on to the professional bodies. And then when there's more information, then you could all work together on this very important issue, because we share a common objective. So how can we make sure that it's done properly? And then in the process, you won't feel, so worried, and you not sure whether you should report a case or not. It's because you can try to consider what's in the bill and how it applies in your situation. And then if there are proper guidelines, then and then if there's good discussion, then you could all work out a feasible way. Now, after this bill is passed by this council, we want the ordinance to be able to help children. Thank you, Mr. Lai, for his comprehensive views. Is really very good. Thank Mr. Ho. Thank you. We'll follow up on your views. Thank you. Are there other members who wish to speak? I see two have asked to speak for the second time, Ms. Lillian Kwok and Reverend Peter Kuhn. Anyone else, please? Now, I let you speak for the second time. Can I ask if the professionals here, if you have anything else to add to the government's response or members' views? If so, please raise your hands. I want to see how many of you would like to speak again. Free, right? Clark, free? Okay. Can I suggest this? I'll draw the line here. Free. Anyone else, please? Okay, so I'll draw the line. I'll invite the free professionals to speak for 2 minutes. And you could put either your questions or make a response. Okay. First, Professor Gilberto Leung. Well, thank you. The government said this is a network and it's about a team. Yes, you're right. That's how we work. We work as a team. But then the criminal liability is for individuals. If you look at the overseas laws, there is corporate responsibility and criminal liability, but for this bill, the liability is essentially for individuals only. So that seems to be different than the spirit of the whole regime. I just want to raise this point for consideration. Thank you. Next, Ms. Fong Siu Lai. Well, what Mr. Lai said is exactly our concerns. So that's why we want to propose a grading system for abuse to facilitate reporting. But it seems that just now the administration said that the reporting only applies to serious harm. So that doesn't seem to be the same with the spirit of the regime. The whole reporting regime is to minimize the chance of child abuse. If action is only taken when there's serious harm, maybe it's departed from the spirit of the regime. So I hope there will be a grading system instead, maybe for different grades of harm. It's a suspicion, or if it's serious harm, then there could be 2 or 3 sub categories and so on. Then we know exactly what we need to do. Third, Dr. Ho Ka Wing, Miss Ho Ka Wing. I would like to give a real example, for the healthcare professional team, and for example nurses, they work for certain organizations, and maybe say after they've made a report, their supervisors are really angry, and they question why the nurse doesn't first inform the social worker or the doctor, and then these who've made reports may lose out on promotion or even lose their jobs, and so that really shakes the determination of nurses to report, because if they report a case, they are the one taking the task. But this has happened, and it's sad because the nurses are just trying to help the abused child, but then they are under immense pressure from their employer. Thank you for expressing your views again. Under Secretary, any quick response, please? Mr. Chairman, I'd like to clarify a concept. We're talking about suspicion of serious abuse cases. There is a statutory duty. But if you see other abuse cases that they are not so serious, but they need to be reported, we would encourage you to report them. We're not saying that because you don't have the statutory duty, then you won't report a case. Now, even if there is not this bill in place, there's already the working group on dealing with child abuse. Okay, maybe you would see a case, it's not serious, but you see a problem, then we encourage you to report the case to protect the child. We're just trying to make sure there's a prevention of the worsening of the situation. But of course, if it's a serious harm case, then you have to report it, otherwise you would have breached the law. So I need to explain that clearly. It seems that quite a few deputations question whether minor cases need to be reported. Well, we would encourage you to report them. And Mr. Lai Tong Kok read out the clause that is has been suffering serious harm or is at real risk of suffering serious harm, and there's no reporting, then yes, someone will be held criminally liable. Now I see 2 members wish to speak for the second time, Ms. Lillian Kwok and Reverend Peter Kuhn. 3 minutes, please, for question and answers. Ms. Lillian Kwok, thank you. I would like to thank Mr. Lai and the deputations for answering my questions. Yes, I know all suspected cases could be reported, but then as many professionals know, if we report each and every suspected case, we wonder if the government could handle it. Can it cope with so many cases? That's why there is this grading system. And if there is this grading system, and we'll try to do our best, and maybe there is professional assessment as to whether the case is serious, less serious, or minor. Or then maybe we may not report the cases, otherwise we might add to the pressure of the government. Or of course, we could report the cases if we wish. But what I'm saying, what I was talking about are the serious cases what is the guideline. So I thank Mr. Lai for giving more information on that. So I hope now the administration has got my points. Now clause 4 bracket 5. A contravention will lead to fine and 3 months of imprisonment. And then clause 4.1 is about serious harm and real risk of suffering serious harm. In particular, I'm talking about mental abuse cases. So what would constitute psychological abuse, because I'm sure there are many such cases. I hope the administration will prepare a guideline before the commencement of the law. You know, people may be caught by the law inadvertently. For example, there are teachers who call children useless. Would that be a form of psychological harm because it adds to the mental stress of the child? But then everyone takes stress differently. So how do we measure that? So I hope the government will talk to the different professionals to work out the different scenarios.
Undersecretary, Ms. Lillian Kwok asked if there will be different guide for different professionals. I hope that you can respond to this question. We are collecting views and case scenarios from the 3 sectors, and we will study the cases submitted to formulate the guide. There will be common things shared by the 3 sectors, and they may have different practices or practice to do something. As to whether or not there will be 1 or 3 guides, we can discuss that. But I believe that there will be a guide on case scenario. Thank you. Reverend Peter Kuhn, please. Thank you. Dr. Lam talked about a case, and I remember one. A&E is faced with immense pressure. Before determining, or when we identify a child abuse cases, it may be noticed by a number of professionals, including doctors and nurses. In A&E, we have to save the patients. And there are emergency cases waiting to be diagnosed. Should we stop our work and make a report first? Because professionals will be held legally liable. When there is a child abuse case, who should make a report? Could be different professionals involved. There could be ABC professionals who are involved. Who should make a report? I would like to thank Mr. Lai for talking about the cases, but the courts will interpret the law. We are unable to interpret it on behalf of the court. As legislative counselors, I have come up with 2 potential scenarios. Can we narrow down the definition of serious harm, say life-threatening harm? Because I have consulted relevant members of the sector, and they think that life-threatening harm is easier to understand. But for bone fracture, it's difficult to determine if it's serious. When there is a custodial sentence involved, people or professionals will be very anxious. Will there be a layman organizations to hear the case first before it going to the court? If the layman organization thinks that the case is substantiated, then the case can go to the court. If not, perhaps the relevant professionals can undergo training first, because a lot of healthcare professionals are subject to registration and a licensing regime. Apart from protecting children, I hope that professionals will not be faced with too much pressure. Chairman, I will invite Mr. Lee, Principal Assistant Secretary, to take that question. Thank you. I will invite the hospital authority to elaborate on this further, but I understand that in A&E and other healthcare settings in hospital authority, there is multidisciplinary collaboration. When multidisciplinary professionals are involved, they have different mechanisms to make a report. Perhaps I invite Dr. Ho, Chief Manager of the Hospital Authority, to talk about that. Hospital Authority, please. Good morning. Hospital Authority deals with child abuse cases. As mentioned by Reverend Kuhn, we are the gatekeeper, and we often receive such patients in A&E, and we take care of patients as a team. We will, when we come across such cases, we will protect the children immediately, and we will admit them to pediatric wards to take care of their conditions as soon as possible. And there is a procedural guide for multidisciplinary cooperation, which was updated in 2022 to protect children from maltreatment. And we have a multidisciplinary case conference, which include pediatricians, clinical psychologists, nurses, and social workers. As a team, when we convene such a multidisciplinary case conferences, relevant colleagues will report on such cases. And when such case conference is convened, we will report the relevant cases to the police or the social welfare department. Meanwhile, we will establish an online platform. Because we often work as a team, the platform will facilitate reporting of child abuse, and we can know which colleagues has made the report. So that it facilitates follow-up work. Thank you. Chairman, I have a simple question. So to put it simply, the hospital authority has a mechanism, but the liability is personal. In the future, doctors will only have to make a report under the regime instead of making a report via the hospital authority. Because to make a report, you have to make a call under the law. So what should the procedures be after passage of the bill? Undersecretary, I understand that there will be a form, and as long as the professional fill out the form with the name of the abused child, then the obligations would have to will have been fulfilled. For details, perhaps you can discuss with the professional panels. The meeting will end at 11:30. I have not spoken. I am the last one to speak, which will conclude the meeting. I would like to thank the deputations for attending the meeting. The members and government's response may have answered some of your questions. For example, I am a father myself. When I bring my child to the dentist and for vaccination, the children are unwilling to do so. When the child throws a fit, the parent will become angry as well. Will we be reported if we just pat our child lightly? I think that we should have a grading system on different harm. Before passage of the bill, I believe that the government will gather different case scenarios to solve the confusion or concerns. For speech therapists or optometrists, They only have to focus on the eyesight or the oral cavity of the child or the speech capability of the child. Sometimes they may not notice the conditions of their arms and legs, and it's impossible for them to lift their clothes. So when these professionals are carrying out their duty, it's reasonable for them not to notice some injuries. You have ways to solve such concern. I'm not sure if I'm mistaken. As I come from work union, the nursing union convey a concern the professionals are sympathetic with the child and sometimes they want to make a report, but the supervisors are in disagreement with the potential reporters. Some management of the professional bodies are businessmen. The law states that we cannot prohibit reporting. Of course, they will not explicitly prohibit the subordinates from making a report, but they may adopt other means to suppress the reporters. I would like to hear from Ms. Ho from the nursing union. Why would supervisors think that making a report is inconvenient? Because we want to treat people. Why would supervisors think that is inappropriate to make a response? What are they thinking? Or can I talk about a case? There is a residential care homes. There is a 16-year-old girl who has a good relationship with the nurse, and she told the nurse that she was sexually harassed by the father. The nurse is sympathetic with the girl because the girl wrote privately to the nurse, and there is no established procedures to report. The nurse accompanied the girl to the police privately, but the nurse ended up having to write reports or be subject to adverse environment at work. Should bureaucracy override the interest of the child? The nurse does not think so. That is why she sat at the police station for 8 hours with the girl, but the organization that she belongs to think that this damaged their image. Thank you. For teenagers, when they come across neglect or sexual harassment or abuse, they are more likely to be subject to such kind of abuse. This is not the first time when I hear a sharing of such cases. Serious physical harm resulting in bone fracture has to be attended to. We all understand that, but for sexual and psychological abuse, this is rather complicated. I hope that the government can look at the matter comprehensively. I would like to see if the Undersecretary has anything to add. Thank you, Chairman. And thank you for the deputations for sharing. I think that after passage of the bill, the nurse will be equipped with some legal authority to carry out her duty. Because the nurse was only carrying out their duties, but they were suppressed by the supervisors. After passage of the bill, it seems that the supervisor will have committed the offense of prohibiting mandated reporters from making a report. So in the future, the supervisors would be too scared to prohibit or inhibit the mandated reporters to make a report by obstructing the promotion of a professional. This is a way of obstruction. Thank you. I would like to thank the deputations for giving us their views. We have conducted 3 public hearings for the 3 professional sectors. Having listened to the views of the professionals and the questions on the legal aspect, the government will make a written response and then we will further discuss the matter. Thank you. The meeting is adjourned.